It's just an absolutely gorgeous day, and it's so wonderful to welcome all of you to this really, really important topic. It is Indian summer, and it is beautiful. I just read a little bit about Indian summer, which occurs in late October and November, characterized by sunny skies, higher temperatures, light winds. I mean, this is the day. This is Indian summer personified. And so glad you could join us for this hour. We're going to be talking about driving safety and preparing for driving retirement, which is a very, very important topic. And Matt will introduce her, but we have an expert from the Massachusetts Department of Transportation, who's the outreach coordinator regarding driving safely with placards, et cetera, et cetera. I have to tell you, as a geriatrician, and you guys know that I'm the section head for geriatrics here, I sometimes would rather tell somebody that they have a cancer, that's a treatable cancer, than to tell them that they have to stop driving or they should stop driving. And even my own mother, when I talked to her about this, because it really wasn't safe, she wagged her finger at me and she said, "You want to see homebound? You're going to see homebound." And so we know that this is a really important topic for all of your autonomy. You all, those of you who are drivers, have been driving since you were 17 or 18. So it's really, really important. And this is a very important topic. And I'm very happy to have you all here today on this beautiful Indian summer day. And I'm going to pass the baton to Matt Russell, our fearless medical director, who's here. And go for it, Matt.
Oh, good afternoon, everybody. Thank you, Sharon. It is a beautiful fall day. It is also Halloween, so I hope that you have your toothpaste ready for later tonight. But it is an absolutely gorgeous day, and thank you for taking the time out to be on this call. Before we get started, just a few housekeeping things. A lot of you are familiar with this already. This is a recorded Zoom session. Please use the chat function to ask questions, but refrain from using asking your own specific health questions, because everyone in the chat function will be able to read that, and we want to preserve confidentiality as much as possible. Everyone is automatically muted so that the speaker can be heard by everybody. And many of you pre-submitted questions for our speaker, and several of you you're always welcome to ask questions about the content in the chat function. So with that, I have an absolute, I'm very happy to present Michele Ellicks. She is the Community Outreach Coordinator for the Massachusetts Department of Transportation's MassDOT Registry of Motor Vehicles Division. She presents licensing, disability placard, and safe driving workshops on behalf of the Registry of Motor Vehicles across the state. She holds a BS from Northeastern University's Boston Bouvet College of Health and Sciences. So we've had great fun getting to know Michele, and we are so looking forward to having this presentation. So with that, Michele, take it away.
Thank you so much, Matt. And thank you to all of the team members of the MGH's Geriatric Medicine Division. And as Matt and Sharon both mentioned, thank you all for taking this time to be with us for the hour. And I present safe driving workshops all across the state. So if you do work with groups, or if you have maybe a support group or some sort of group that you would like the Registry of Motor Vehicles to present to, I would be more than happy to come and present to your group. And I did put my email address in the chat for all of you. So I feel like anyone who takes the time to attend a workshop, especially one of my workshops, you absolutely feel free to email me directly, because I know sometimes it's difficult to ask a question in a group setting. So you have my direct email in the chat, and I'll repeat that email, but it is my name, michele.ellicks@dot.state.ma.gov. US. So let's get started. Today, we'll talk about age-related changes and their impact on driving, concerns that we see as we age and these age-related changes develop. If they go unchecked, they absolutely may impact a person's ability to drive safely. The warning signs of unsafe driving. We'll also touch upon driver fitness, the importance of driver fitness and assessments that are available, driver training as well, license renewal policies, a little housekeeping as well to make your life a little easier, but how to make an appointment at the registry, because any licensing transaction, identification card transaction, or real ID does require an appointment in advance. Reporting procedures, resources, and as Sharon and Monique mentioned, I will also touch upon disability placard, the application process. So when we look at older drivers as a group, we see that older drivers tend to have a low crash rate, and that's something to be very proud of. And it really has to do with the fact that many older drivers tend to regulate themselves or put self-imposed limits on their own driving. And some examples of these self-imposed limits are sticking to familiar roads. Maybe a person no longer drives across country, or maybe they don't, if they're a snowbird, they're not driving to their winter destination, and they find, in fact, my own in-laws did exactly that. They were snowbirds. They'd go to Florida every winter. And after a while, that drive became very taxing. It was exhausting for them. So they figured out a way to put their car on a carrier, and they had the luxury of getting on a bus and riding a motor coach from Massachusetts down to Florida. That's a way to regulate one's driving. Maybe avoiding nighttime driving, absolutely. Vision, age-related changes in terms of vision and night vision also can impact a person's ability to drive. So scaling back nighttime driving might be an option for some. Another limitation, a self-imposed limit, is avoiding high traffic times of the day. Maybe you have the luxury of not having to drive into work every day, and you can schedule your appointments or schedule whatever it is that you like to do a little bit later in the morning or mid-afternoon before the evening rush. And another encouraging statistic is that older drivers tend to be less likely to use mobile devices while driving. They understand the consequences for the most part. Now, what is concerning is that the crash rate does indeed increase with age. The fatal crash rate increases noticeably for drivers age 70 and older, and the fatal crash rate is highest among all other age drivers. The fatal crash rate is highest per mile driven among drivers age 85 and older. And the high rate of fatality in terms of a crash really has to do with maybe the older person may not be able to withstand the impact of a collision. And research shows that primarily the injuries are sustained to chest, and also fatalities are due to medical complications as the result of a collision, rather than the increased tendency to be involved in a collision. So what is happening? What is, no pun intended, driving up the crash rate and making older drivers more vulnerable? Well, medically speaking, and I'm absolutely addressing to the experts in the room, but functional impairments absolutely can impact a person's ability to drive. So in terms of what is happening that truly will impact our driving if these age-related changes go unchecked are vision diminishes in so many ways. And a few examples of the way our vision changes that can impact our driving is we tend to lose light perception. So as I mentioned, nighttime driving can be problematic for many people. In fact, AOTA, American Occupational Therapy Association, researched, well, how do our vision changes impact our driving? And they found that most people begin to notice a decrease in their night vision or low light vision at age 40. So it's really important to address any of these changes, but decreased light perception. Peripheral view tends to get smaller. So our useful field of view, that's where do we naturally focus when we are driving, that tends to get smaller. Some of us may lose depth perception, and we need that depth perception to be able to see clearly a distance, or to if you're making a left turn, to identify how far away is that car from you, and do you have time to make that turn. So those are just a few ways. And visual acuity, our eyes' ability to distinguish the pedestrian or the person that's walking in the roadway or the bicyclist on the road. So critical, good vision is critical to safe driving, as is reaction time and reflexes. We need to be able to react quickly. In fact, AOTA again not only measured how our vision changes, but they measured how our reaction time can slow down. And what they found in their research is that for a person in their 20s, the reaction time is maybe 3/4 of a second to a second, maybe quicker for some. But again, that's when we were in our 20s. By the time we reach age 60, the reaction time can slow to as much as 4 seconds. Now, if I'm sitting in a chair in my home and I'm not moving, 4 seconds may not be dangerous to me. But as you can imagine, 4 seconds when I'm behind the wheel can absolutely mean life or death. What also tends to diminish with age and can absolutely negatively impact driving if it goes unchecked or as it progresses is cognitive ability, and in particular, divided attention. But when we think about driving, our eyes, most of the information we gather comes from our vision. So 95% of the information we gather comes from our vision. That information is sent to our brain. Our brain processes what is the situation, what is the hazard. Our brain's recalling what does the law say in this situation, who has the right of way. So your brain is making rapid fire decisions on how to execute a maneuver to keep all road users safe. So really driving can be an extremely complex activity or task. So hearing is another functional impairment that can absolutely impact our ability to drive safely. Then add to that medications. Most people in their 60s or maybe even younger maybe taking one medication, maybe taking multiple medications. It is critical to be aware that medications can be of a concern in terms of driving. However, I'm not saying don't take your medication. Absolutely work with your healthcare provider to make sure that the medication you're taking is not impacting you in any negative way. So many medications may cause, well, there are many medications that may cause side effects, such as making you feel drowsy, sleepy, dizzy, lightheaded, excitable. Maybe it causes nausea, inattentiveness. Maybe it slows your reflexes down. These are just a few of potential side effects. So again, work with your healthcare team. And when you begin taking a medication, you must pay attention to how does it make you feel if you want to continue driving safely. And I tell you this because Massachusetts, operating under the influence law, so the Mass General Law, Chapter 90, includes operating under the influence, which states that it includes prescription medications, over-the-counter medications, and then, of course, operating under the influence also includes alcohol and illegal substances. But be very truthful with your healthcare provider and let them know if you do find that this medication is altering your baseline or making you just feel a little bit off. I tell you this because my own mother developed high blood pressure. She was prescribed a high blood pressure medication, very common. And within 2 days, She felt exhausted. All she wanted to do was sleep, and this was not a characteristic of my mother. Endless energy prior to taking this medication. So she was very smart, handled it perfectly, and called her geriatrician and said, something's off. I'm not sure what it is. Over the phone, they figured out that she was having some really odd interaction with this medication. Over the phone, she diagnosed, and the geriatrician actually prescribed a different brand, a little slightly lesser dosage for my mom, and told her to take that medication at night, and told my mom, do not drive for at least a week until you are taking this new medication for at least a week, and call me and tell me, how do you feel? And then we'll determine whether or not you're safe to drive. My mom followed all her recommendations and her prescription, and she drove safely for at least 17 years with no incident ever. So I tell you this because the liability to make sure that we are safe to operate a motor vehicle falls on each and every one of us, the license holder. And that does include making sure the medication does not impact our ability to drive. Now, in Massachusetts, the Massachusetts policy is once a person turns age 75, the person can no longer renew their driver's license online and must come into the Registry of Motor Vehicles and renew in person and take and pass an eye test. You can also do this at AAA if you're a AAA member. But again, in-person renewal is required starting at age 75, and that's every 5 years. The liability, as I mentioned, so Massachusetts is a self-reporting state, and this is where the liability lies. The license holder must report any impairment or any medication that might impact their ability to drive when they are renewing their driver's license. But more recently, this piece of the law was also changed to include that a person must self-report whenever a medical condition appears or occurs. So not just at the license renewal stage, because again, as I said, a license is valid for 5 years. Every 5 years, you must renew your driver's license. And if you're 75, you renew it in person. But lots of things can change in terms of our health within even a year. Mobility and medical conditions can change. So it's very important that you work with your healthcare provider, but also tell us at the registry. One way you can do it is when you renew. As I said, page 2 of the license renewal application includes a mandatory section where any license applicant, whether they're applying for the first time or renewing their license, they must tell the registry if they have any medical condition that might impact their ability to drive safely. That's a yes or no answer. And the second question we ask on page 2 of the license renewal application is, are you taking any medication that may impact your ability to drive safely, yes or no? So therein lies potential liability, because again, all the responsibility falls on the license holder to make sure that you are safe and you work with us at the registry. Answer these questions honestly. If you answer yes, so you want to renew your license, you have a medical condition, you think it might impact your ability to drive. So if you answer yes, it may not be the end of the road. We will hand you a medical evaluation form to take to your doctor. Have it filled out, bring it back to us, and after reviewing the doctor's recommendations, we will make a decision whether or not to renew your driver's license. Or maybe your healthcare provider suggests a competency road test, and I'll get into that in a moment. But it really is truly important that all of the responsibility falls on the license holder. In Massachusetts, keep in mind, the safe driver law that was passed back in 2010, the safe driver law provides immunity for healthcare providers who either report a patient to the registry or do not report a patient to the registry, you, the healthcare provider, cannot be sued for your decision, whether you report or not. So that's very important to keep in mind. If a healthcare provider is reluctant maybe to report their patient to the registry because they're in fear of any sort of lawsuit, that will not happen in Massachusetts based on a driving decision for the healthcare provider. So I talked about this at length, drive self-reporting state, and this is the amendment to the if any medical condition that affects your driving appears or occurs, you must notify the registry, regardless of when your license expires. Okay, so that's really important. And how does one do that? You contact us at Medical Affairs. The Registry of Motor Vehicles Medical Affairs telephone number is 857-368-8020. Again, 857-368-8020. Call us and we'll walk you through the process. We'll send you the paperwork that you need, and that will protect you from any possible liability if you do continue to drive with a medical condition that impacts your driving. You could possibly be sued for any damages or injury or death that through the investigation that is found that you have caused. So what are some of the warning signs? How can we assess our own driving? We have a complete list on our website, but also in our resource, Your Health and Driving Safely. But here are some of the red flags to be on the lookout for. Having difficulty seeing at night or at dusk or dawn, low light conditions, if they're problematic, that's a red flag. Speak to the eye doctor, talk to your clinician and tell them what is causing difficulties and what is impeding your vision. Having difficulty keeping up with the posted speed limit, or on the flip side, really using excessive speeds. So using inappropriate speeds is also a red flag. Being intimidated by passing vehicles, being easily distracted while driving, having difficulty seeing the police officer in detail, or having difficulty following construction detours. Has the driver gotten lost, and are they getting lost on once familiar roads? Again, a red flag. Or maybe you have noticed scratches or dings or dents in a loved one's car. Again, these are warning signs of unsafe driving. And if you see something, say something. Or if you're answering yes to some of these questions, discuss it with your healthcare provider. I cannot stress that enough. Okay, so professional driving evaluations, if you'd like to take it one step further and get a professional evaluation, there are lots of hospitals and rehab centers in Massachusetts that offer driving evals. They're on an outpatient basis. Unfortunately, at this time, insurance does not cover a professional driving evaluation that's done at a hospital or a rehab center. But when you think about the cost, okay, so you can shop around, call these programs. The costs range anywhere from $200 to $700 or $800, depending on the facility, depending on the extent of this evaluation. Again, in our brochure, Your Health and Driving Safely, pages 9 and 10 have a complete list of all of these facilities. But let's think about out-of-pocket expense, $700, $800, compared to if I have a medical condition that is negatively impacting my ability to drive, and I continue to drive and I cause a collision. Through the investigation, it's determined that my medical condition progressed to a point where I should not have been driving. For instance, my mother-in-law lived all her life, most of her life, with diabetes. By the time she reached mid-70s, her neuropathy had progressed so that her diabetic nurse said, Jackie, you cannot feel the bottom of your feet anymore. That will absolutely wreak havoc on your driving. And she told her point blank, you need to stop driving because of the effects of that medical condition. So it's important to know that it's not necessarily the diagnosis that determines if a person is safe to drive or not. It is, what are the effects of that condition on your body, or what are the effects of that medication on your body? So think about it. If my mother-in-law continued to drive after her healthcare team told her, you've got to stop, she would have been liable. Insurance would not have covered her. She could have been sued for millions, all her assets. So she was smart. She took their advice and she found another way to get around. Now, mobility can change in an instant. So many of these hospitals do share the results of the driving eval with the Registry of Motor Vehicles. And truly, it is money well spent if it prevents a crash, injury, or death. Competency road test. Now, this is an evaluation done right at the Registry of Motor Vehicles, and it is a road test. It does require, it can be required by your healthcare provider, but it also can be requested, it can be requested by a healthcare provider, but it also could be requested by any license holder. The way you request it is you would contact Medical Affairs and submit a form to the Medical Affairs Bureau, and then we'll send you a packet with information on how to book the road test, what's to be expected. And for $35, you can come to any of the full service registries by appointment and take and pass that competency road test. So driver training programs, again, assessment. Driving is, as I said, a very complex skill. The great news is there are lots of resources out there for drivers. AARP, Safe Driver Program. Usually it's presented at councils on aging across the state. There's a minimal fee, but really and truly, that's a great driving refresher class. AAA has great resources as well, and one of them is the Roadwise Driver, and that's an online assessment. And the results of that assessment are only for you. It does not get submitted to the registry or to your healthcare team. Another really great program, and this is a cooperative effort, is called CarFit, and it is a partnership between AOTA, which is, again, Occupational Therapy Association, AAA, and AARP. And these are events that happen at locations. So you would drive to this CarFit event, an occupational therapist will look at you, they'll look at your vehicle, and they'll help adjust the seating, the mirrors, the angle of your steering wheel, and they'll help you fit better in your own vehicle. Let's not forget driver's ed. Yeah, I took driver's ed 40 years ago. But driver's ed is for every age. In fact, my own mother, I used her example earlier, but my mother absolutely contacted driver's ed. She was 72. She had developed pneumonia, ended up in rehab. Thankfully, she recovered and was discharged back home, fully discharged, fully functioning, safe to drive. She was a little nervous about returning to driving because she had been in rehab for about 8 weeks. So she called the local driver's ed school and she said, do you offer driver's ed to older adults? And they absolutely do. So don't be afraid to contact driver's ed. My mom booked 2 one-hour sessions on the road. The driver's ed car came to her. They, familiarized her with the car, and off they went for an hour lesson. After that 1 hour lesson, the instructor said, let's cancel the second hour. You're doing great. You've driven perfectly. So that gave my mom the confidence back. So don't be afraid to contact driver's ed for some instruction. I've talked already about driving evaluations at hospitals. But also a great resource for you is Chapter 4 of the driver's manual. So when's the last time you looked at a driver's manual, right? So it's packed with information, rules of the road, new signage. Again, focus if you don't have time to read the whole driver's manual, which I wish you would, but chapter 4 is the safety section. So my question to everyone on this Zoom today, what is your plan for driving retirement? We plan for so many things in life, our vacations, our own retirement. But who here has planned for not driving? Mobility can change in an instant. And we need to know that we will be able to get to the places we need to go. Maybe you're helping with childcare. How are you going to get there if you do not drive? You're volunteering or you're working. How will you get there if you're not driving? The reality is that we will live 7 to 10 years beyond our driving abilities. So women tend to live 10 years beyond their driving ability. Men tend to live 7 years beyond their driving ability. Think about your options. Talk to the Council on Aging. Talk to friends. Maybe you have a friend who stopped driving. Talk to them about it. How do they get around? What's available? So plan for driving retirement now before driving becomes a crisis. And for clinicians and providers, it is important to also ask your patient about their driving. What is their plan? And obviously, always, if you are driving or if you're a passenger in a vehicle, always buckle up. And that's another important question to ask. Are you wearing your seatbelt every time you get in that vehicle? Especially for us, for older adults, we may not be able to withstand the impact of a motor vehicle collision. That seatbelt in conjunction with the airbag can keep us from getting injured or save our life. So I know one of the questions that came up is, how do I talk to a friend about not driving? First and foremost, gather information. Go armed with options. If you're going to talk to someone about giving up the keys or scaling back their driving, you must go with options and information on what is available. What are the alternatives? Another bit of advice is ride with the driver. If you're basing your concerns simply on their age, that's not the sole indicator for safe driving or determining if someone is safe to drive. So again, it's not solely the number of birthdays that we celebrate that determines if we're safe or not to drive. Observe their driving, ride with the driver. And when you get to a safe location, have that discussion. Identify and assess. Where have you driven recently? And make a list and identify how would you get there if you did not drive. Research public transportation, local COAs. When my mom finally gave up the keys, and she did have to because of another health condition, her doctor said, it's time, you've got to stop driving. And, I get teary thinking about it because it was a loss for her. She was living alone, living in the town of Uxbridge, not a lot of public transportation there. And she was finally told later in life that she had to stop driving. She relied very heavily on the Council on Aging. And it was such, if after 2 weeks, 3 weeks, we could see it was a burden that had been lifted from her shoulders. She met people that she never would have had an opportunity to meet by taking transportation. And I'll never forget. And of course, I drove her and my sister drove her. We loved spending time with her and we gave her rides, but she didn't want to be a burden to us. So she would accept a ride once in a while. And one day I took her to the library. She was a reading teacher. She loved to read. She was a member of 2 book groups. And the librarian said, "Hey, Marie, I haven't seen you in a while. Where have you been?" And I was, just listening in. And my mom said, "I had to stop driving, so I can't get here as easily." And the librarian said, "Don't you worry. call me or I'll call you when new books come in that I think you'll like, and I'll bring them to you. And when you're done with them, I'll come and I'll pick them up, and we'll arrange for transportation for you to get to the book discussion group that you so love. So really and truly, it can be a loss, but it also can be the relief and less of a burden to have to drive when you may not be safe to do so. But don't be afraid to ask and contact me, and I'll walk you through. I had another student in one of these classes say, "Hey, I created a transportation account. A while back, I started putting $5 a month away in an account earmarked for my transportation." That's a great idea as well. A driver's license, the bottom line is, it is a privilege. It's not a right. None of us has the right to drive. It's a privilege that comes with a great deal of responsibility. In Massachusetts, if a person does decide to voluntarily surrender their driver's license, and if there is still time left on that driver's license, it has to be at least 3 months left on that driver's license, you can surrender that license through the mail. We'll deactivate the license, and you fill in this, you submit a surrender affidavit, a license surrender affidavit to us at Medical Affairs. We'll deactivate the license and send you a Massachusetts ID card free of charge. But again, the catch is the license cannot be expired. If it has been expired, we do have another process in place, and I'd be happy to walk you through that one-on-one individually at a later date, because I know we're pressed for time. Resources. These, all of these resources are linked to our older driver safety website, which is on mass.gov/RMV. Again, that's our website, mass.gov/RMV. And in the search bar, just plug in older drivers, and you will come to our older driver page. So I just will stop sharing my PowerPoint at this point, and I want to thank you all, first of all, for attending and listening to this presentation, and I'd be happy to take questions.
Thank you so much. That is, it was so informative, and I will just echo what you said, that this is not just the simple wheels and transit. It means so much more in terms of people staying involved and participatory in life, and yet safety does have to be paramount. We will be in positions as clinicians where patients will have had those fender benders, and their license may have been suspended on the spot by the police or withdrawn, and then we're asked to provide medical clearance. So in our clinic, if we're ever asked to provide medical clearance, we will insist that somebody have a road safety test. And the reason is multifaceted. Number one, family members will often express, "Doctor, you have to tell my mother she can't drive." And, because we don't think she's safe. Or a patient has multiple medical conditions, but not necessarily something impacting their cognition, but certainly could impact their reflexes. There are so many different factors going on at any one time that we say, if your license has been suspended or taken away, in order to get it back, you definitely should do a road safety test, and we won't certify people unless they've done that. And it's just because the likelihood that this is the watershed moment. This is the moment when the fender bender is the early warning. We don't want to wait for the fatality to then say, yeah, you really shouldn't have been driving. I will also say the things that are commonly heard from our patients is, I would never get behind the wheel of a car if I thought I was going to hurt someone. That's pretty much true for all of us. And accidents are accidents. We don't intend to have an accident. We don't intend to go out and cause havoc for the most part. We are having car accidents by accident. Similarly, a lot of people will say, well, I don't drive at night and I only drive on familiar roads. And as many of us know, the majority of accidents happen within a 5-mile radius of our home. So all of these things really from us as clinicians, it brings that, like, if there's ever a concern, we will often say, please, for the sake of your family, for the sake of your own sense of confidence, and for the sake of us, get yourself tested, see how you do. And if they say, yes, we don't think you should be driving, how do you prepare yourself to hear that news? And again, my mom is in the same boat, Michele, as yours. She lives in a part of the city where there's not a lot of public transportation options. But, are you going to drive up until the day you die? Most of us know the answer is not. And we don't want the day you die to be because of an accident. So it is so key to have that open and honest communication with your provider, and also understand where we're coming from around this issue. And I'll just echo what Dr. Levine said, which is, this is the hardest conversation in geriatric medicine. It is not discussing diagnoses and whatnot. This is linked to autonomy and independence. And this is about a person's ability to just go under their own steam. And if you've ever heard me say this in any other previous town halls, as we get older, when we're younger, we're rowboats. We are the ones rowing that boat. We're the captain and the crew, and it's very obvious where we're going and what we're doing. But as we age, we become cruise ships. We're still the captain, but we have a crew. And we have a crew that's painting the handrails. We have a crew that's working in the engine room. You still have that autonomy, but you need to have a crew. And that's where those transportation options are really key. You still have the ability for self-determination to go where you want to go, but you're not putting yourself or others at risk. Are there any questions in the chat function? None.
I have a comment. I have a couple of comments and a question for Michele, which is, there used to be a place on the registry's website that if you were worried about somebody, you could put in a report that you were worried about this person driving. It could be a family member. If people don't want to get into it at home, they might want to do it that way. Can you comment on that? And then I have a daughter who's an urban planner, and she works a lot on safe streets for older adults and kids, for everybody. The thing that a lot of people who are older do is they don't, on a left turn, they will often cut off. So what's happening now in many places to try and stop that is to put a shrubbery and foliage on the sidewalk around that left turn, so that people can actually see that as a marker, and as an adaptation that is done by municipalities and states. So things are getting better on the side of planners and urban planners and city planners. So that is a very good thing, and it's with older people in mind, but also the fact that if you're worried about somebody, you can put a report in to the registry. And maybe you could tell Michele what would happen if they got a report like that.
Thank you. Dr. Levine, thank you for that, and for the urban planning comment as well. So let me just address that first, because you mentioned left turns. And as a group, older drivers tend to be overrepresented in crashes that involve turning left, merging onto a highway, changing lanes, exiting from a parking lot, or exiting from a driveway, or backing out of a parking spot. So this whole group of maneuvers falls under failure to yield the right of way. So older drivers tend to be overrepresented in crashes that involve failing to yield the right of way. So experts advise limit or eliminate left turns unless there's a designated left lane or a traffic light that can help you. Because if we're trying to make a left turn on our own, it's an extremely difficult maneuver. And we're relying on our vision. We're relying on our reflexes. We're relying on, getting the big picture, what's going on around me. And then how fast is that oncoming car going? And the other thing to keep in mind, the person making the left is almost always at fault. So the person making the left will always be at 99.9% of all crashes. The person making the left turn is at fault. So that's another reason to limit or eliminate left turns. So your first point, Dr. Levine, which who can file a report to the Registry of Motor Vehicles about a potentially unsafe driver? In Massachusetts, the only reports that we can take action on are those that come from experts identified by the Commonwealth of Massachusetts. And those experts, in terms of assessing a person's driving, are healthcare providers and law enforcement. So prior to 2010, it's prior to the Safe Driver law that went into effect, you were right. Family members could report, social workers could report, a neighbor could report their neighbor to the registry. But that law has since changed. So the only experts who can file a report are law enforcement officials and healthcare providers.
We have been told that that's a breach of patient confidentiality. And I think, and so I think that's a really, that I don't know if that's in every hospital or every state, or whether it's just something that happens in certain situations. But I think that's one of those things that's ambiguous. And I do think it is important for law enforcement or others to report, especially if a family member can't. We're not in the days of the carburetor anymore, where you could take the spark plugs off, like in The Sound of Music, so the car doesn't go anywhere. I mean, it's a different world that we live in, and you can take away the keys, but you can't necessarily take away the car. People are very wily and very smart, and if they want to find a way, they will find a way. And I would just make one other comment, which is I have had the terrible, terrible situation of having a patient who had her license taken away and had a patient driving in the car and got into an accident, and there was a fatality. And you never want to be in that position. And all of us in medicine never want to be in that position. When we see these things on the news, it's really, really terrible. So I think it's important. And I think the only other thing that I would say is that there are wonderful adaptations that can be made. MIT Aging Lab has a whole set of things that can be done to help disabled drivers who can't bend their knee and get into a car easily, who can't reach up and fix a mirror or on the outside. And there are all kinds of stuff like this that can be done in places like Spalding Rehab, have, ways of accommodating people who are, have paraplegia and are still driving. So I think it's really, really important to know that there are options in addition to, to us, but that can be made to a vehicle that might be helpful for us if we would otherwise cognitively and every other way that you talked about, be able to do the kinds of things that it takes to be a safe driver.
Absolutely, absolutely. The adaptive driving devices, there are many. So I'm echoing that your sentiment that if there's a loss of limb or the loss of the use of a limb, it might not be the end of a person's driving life. There are lots of adaptive features. Options are key. One thing I forgot to mention in terms of having options that reminded me of driving alternatives. And I did talk about public transportation, excuse me, and the regional transit authorities throughout the state. There's a great program through the MBTA as well as these regional transit authorities called travel trainers. And I'm not sure if anyone's heard of these, but many of these transportation agencies, including the T, have staff who are travel trainers, and they will accompany a person on a trip, essentially take a field trip by taking the T to whatever the destination is. They'll teach a person how to pay the fare. They'll teach the person how to find out what the bus schedule is. And they will physically go with the patient, with the person, and ride with them and help them become more comfortable to navigating the world of public transportation. So keep an eye out or ask for travel trainer programs in your community.
Great. And we do have a question just to just clarify. The CarFit event is different, right, than the simulator at, say, one of the Spalding rehabs?
Yes, absolutely. The CarFit event is really just an assessment of looking at your vehicle and how are you seated and making adjustments, simple but effective adjustments to your own vehicle. So it is not a driving simulator. It is literally occupational therapists with a checklist, and they're dispensing safe driving information, but they're also helping you fit better in your own vehicle.
Great. Thank you so much.
You're welcome.
Any last minute questions? Well, I want to thank Michele Ellicks for a wonderful presentation that I was furiously typing down resources, and this was really informative. Please, reminder, this is a recorded event and will be available in about a week or two on our website for MGH Geriatric videos. And you'll be able to pass this on to friends and family as a friendly way of getting these resources. As a reminder, our next town hall will be on Thursday, November 14th at a special time between 4 and 5 p.m. as I have the distinct pleasure of interviewing Dr. Sharon Levine, our departing section head, to hear her words of wisdom and her farewell message to us all. So please tell your friends to attend. I think it will be a great discussion. If you've not had the opportunity to hear Dr. Levine in her teaching space, this is truly a wonderful thing. And she is the reason why I do geriatrics. So I'm very much looking forward to this event. Thank you all again for attending. Happy Halloween. Get out and enjoy the sunshine. And we'll see you in November.
Thank you.
Bye, folks. Thank you, Michele.
Thank you.
Thanks, Michele.
You're very welcome. Thank you.